Hi there, welcome to Wig Medical's channel. My name is India Mason, CEO and founder of Wig Medical, and I am so happy you joined us. Today we're going to talk about the most common types of medical-related hair loss. In the United States, hair loss affects over 80 million Americans. Within the 80 million, 46.5% of that hair loss is medical. There are many different types of medical-related hair loss, but the most common range from alopecia, cancer-related chemotherapy, burn victims, trichotillomania, as well as scalp infections. Many women also experience postpartum hair loss related to life-changing events, as well as hair loss associated with side effects from different medications. The first type of hair loss we are going to explore is one of the most common, alopecia. Alopecia, simply put, just means hair loss. The most common types of alopecia are alopecia totalis, alopecia universalis, scarring alopecia, and traction alopecia. Both alopecia totalis and alopecia universalis are more advanced forms of alopecia that result in total hair loss all over the body. This means hair loss happens around the eyebrows, arms, legs, and other parts of the body as well. Scarring alopecia, also known as cicatricial alopecia, refers to a rare disorder that causes permanent hair loss. Examples of scarring alopecia include hair loss that is accompanied by itching, burning, the formation of blisters, crusting, and patching of the scalp. Traction alopecia is hair loss that is usually due to excessive pulling or tension on the hair shafts as a result of certain hairstyles. This could be braids, sew-ins, ponytails, and even some types of wig application. The second type of hair loss we will talk about is hair loss related to cancer, chemotherapy, and other types of medically induced hair loss. Frequently, clients that are undergoing chemotherapy and radiation experience hair loss due to these treatments. Hair loss can happen as a side effect of chemotherapy, targeted therapy, radiation therapy, or a stem cell or bone marrow transplant. These cancer treatments can harm the cells that help hair grow. During cancer treatments, you may experience hair loss, scalp irritation, and sensitivity. The medical term for hair loss due to chemotherapy is anagen effluvium. Cancer and chemotherapy are not the only causes of medical-related hair loss due to illness. There are many other illnesses that can contribute to medical-related hair loss as well. Another type of medical-related hair loss are burn and trauma victims. Whether it's a physical or chemical burn to the scalp, hair loss is almost inevitable. The resulting scar tissue on a damaged scalp cannot regrow hair and leaves an unsettling reminder for most victims of the traumatic event. Expensive invasive hair transplant surgery may not be as ideal as it adds more stress to your already traumatized scalp. Additionally, it is considered cosmetic therapy and is therefore not covered by most insurance plans. Traumatic events, such as natural disasters and even pandemics, can all be contributing factors to medical-related hair loss. On average, 37% of new mothers experience hair loss postpartum or during pregnancy. Next up, we have trichotillomania. Trichotillomania is a physiological condition noted as a compulsive disorder to pull one's hair from the body. It could be from your scalp, eyebrows, or any other areas of your body that grow hair as well. Despite trying to stop, most clients say that this compulsion results in noticeable bald patches and hair loss through acute regions of their body. It is thought that trichotillomania is more common in children than adults. The severity of presentation appears to be higher in adolescents. This means that adolescents to young adults usually have a more long-lasting form of trichotillomania. Trichotillomania is mostly triggered by anxiety, impulse, as well as dysregulated mood disorder. Another cause of medical-related hair loss are scalp infections. The most common are ringworms, scalp psoriasis, seborrheic dermatitis, and Leishman planius. These infections can lead to permanent hair loss, making clients that suffer from any of these infections eligible for cranial prosthesis as well. This concludes our video. It's important to note that these are just a few of the types of medical-related hair loss, and that as more information develops, your role is to help clients obtain a sense of normalcy by providing the appropriate recommendations that are appropriate for their type of medical-related hair loss. Thank you guys so much for joining us. Until next time.